Well, thank you, Mr. Chairman and Ranking Member Camp and members of the committee. As the Chairman has already said, this is my first opportunity outside of the confirmation hearing process to have an opportunity to have a discussion in Congress, and my first time before a House committee, and I'm pleased to be here with the House Ways and Means Committee and members. And I know today is just a beginning of what I hope will be a robust and frequent conversation as we move toward the goal of health reform and health coverage for all Americans. I'm pleased that Ranking Member Camp has already recognized that actually I'm one of his constituents. I pay property taxes, I might say too many property taxes in your district, but I think it's an opening of bipartisanship demonstrated from the outset. I'm not Chairman Rangel's constituent, I'm Representative Camp's constituent. Given the time shortage, Mr. Chairman, you have my printed testimony, and I'm going to just highlight a few things and then talk a little bit about a couple of the reports that I spoke about today with the Nurses Association, because much of what is in the testimony this committee is well familiar with. The need to provide health coverage, particularly because the costs of the current system are unacceptable and unsustainable for businesses, for families. What we've seen is the situation getting worse. Costs continue to escalate and more Americans lack coverage. And I share the President's conviction that health care reform cannot wait and will not wait another year. Many steps have been taken by members of this committee and others in the first 100 days to set a platform, ensuring 4 million more American children, providing resources in the Recovery Act for a variety of initiatives, health and wellness programs, funding the pipeline for new workforce efforts, making sure that the resources are there for implementation of health information technology, which can be an underpinning to moving the health system in a new direction. And I share the President's belief that reform must guarantee choice of doctors and health plans, including a choice between a public and private plan option, that no American should be forced to give up a doctor they trust or a health plan they like. And comprehensive reform shouldn't force any American who are satisfied with their coverage to make changes. But covering every American, access to the high-quality health care is so important. And the two reports that I'm issuing today as the new Secretary of Health and Human Services, I think, highlight some of the underlying issues that we're facing. Today we're releasing the National Healthcare Quality Report and the National Healthcare Disparities Report. And both of these underlie troubling findings about the status quo of our healthcare system. The Disparities Report again highlights that severe and pervasive disparities in care continue to persist in this country. Minority patients still receive proportionately poor care compared to their Caucasian neighbors. The Quality Report highlights that 40%, 4 out of 10 health care patients, don't receive recommended care. And that's an ongoing situation. And again, prevention measures are too often lacking. Half of the obese adults and children who see a doctor are never given advice to exercise more frequently and eat a healthy diet. And most troubling is the decline in patient safety measures identified in the Quality Report that have worsened every year for the past 6 years. When you look at the underlying causes, patient safety is down because the number of patients acquiring health care-associated infections has gone up. Patients come to the hospital to get well, and unfortunately, too many of them are acquiring potentially fatal infections. It has become one of the top 10 leading causes of death in the United States. and the infections are thought to cause about $20 billion a year in additional health care costs. So we are challenging the health care providers to work with us on attempting to fix this problem. Thanks to your support, the Recovery Act now includes $50 million to help prevent healthcare-associated infections, and as of today, the Department is prepared to begin to release those funds. $40 million is aimed at states to expand their infection prevention teams and educate and collaborate with patients in hospitals to keep patients safe. An additional $10 billion is supporting increased inspections of ambulatory surgical centers, which are all too frequently a site of these lethal infections. And we know that one particularly common and dangerous infection is the central line-associated bloodstream infection. And it strikes tens of millions of American patients every year, and that number increases year in and year out. But there's a relatively easy cure. Research has found that the hospital checklist protocol, if implemented uniformly and on a daily basis, dramatically reduces these results. Medicare has been studying this in 10 states. We want to expand that protocol to all states. So today, Mr. Chairman, as part of this effort to begin to transform the underlying system, I'm issuing a challenge to hospitals across America to commit to using the patient safety checklist in all hospitals and reduce the serious bloodstream infections in intensive care units by 75% over the next 3 years. That's what our data tells us can happen. If the checklist is used, infections will go down. We want to include every hospital in every state. This morning I spoke to the Nurses Association and asked them to join in this effort, and we'll be putting this challenge out to hospital administrators across the country. So, Mr. Chairman, I know you and members of this committee share my concerns about the quality of care and the need for comprehensive health reform. And I want to thank you in advance for the hard work that's already been done to set the platform for this historic moment. And I want to assure you that I will do everything I can to work closely with this committee and others here in the House and across the rotunda in the Senate to make sure that we take advantage of this opportunity. And with that, Mr. Chairman, I would stand for questions.